Non-alcoholic fatty liver disease describes a range of conditions caused by a buildup of fat within the liver. In some instances, this excess fat can lead to inflammation of the liver, otherwise known as non-alcoholic steatohepatitis or NASH. If this inflammation gets worse, it can lead to severe liver damage, and the function of the liver can be disrupted. While this liver damage resembles that caused by alcohol, NASH actually occurs in people who drink little or no alcohol, and can even occur in children. The main risk factors for developing NASH include being overweight or obese, having type 2 diabetes, high blood pressure, and/or high cholesterol. NASH generally has few or no symptoms, particularly within the early stages of the disease, and you may only start to notice symptoms once the disease becomes more advanced. These can include a persistent pain in the upper right of the abdomen, tiredness or weakness, and weight loss. Therefore, it is important that NASH is identified by your doctor as soon as possible, as having this condition can increase your risk of cardiovascular disease, liver cancer, and liver failure. There is currently no drug treatment available to stop or reverse NASH. However, various medicines are being researched in different clinical studies. A clinical trial asks important questions about a potentially new treatment, including: is it safe? Does it work? Are there any side effects? If you have been identified as having or possibly having NASH, you may be invited to take part in a clinical trial. The details of the trial will be clearly explained to you, including the possible benefits and risks. Taking part in a clinical trial is voluntary and entirely up to you. You can take your time to decide whether or not to participate and to ask any questions you may have. When you're fully informed, you can confirm whether you wish to take part by signing an informed consent form. It's important to realize that this form is not a contract. If you wish to leave the trial at any stage, you are free to do so. In clinical trials involving NASH, it is important to be aware of some of the key procedures that will be performed. Diagnosis of NASH is typically done by a routine blood test that measures the levels of substance in your blood called liver enzymes. Although not always predictive, if these enzymes are abnormal, this can be an early indicator of NASH. The condition of your liver may also be assessed non-invasively using a scan known as an ultrasound, MRI, or MRE, specialized types of imaging that measure the fat content and stiffness of the liver. These are painless scans used to create images of your liver for your doctor to examine. To confirm your diagnosis, a liver biopsy may be performed. Generally, a liver biopsy is a safe procedure. However, some risks are involved with any invasive procedure. Your doctor will discuss the risks and benefits with you in more detail and will answer any questions that you may have at any time. During this procedure, a qualified doctor uses a special needle to get a small sample of your liver tissue. You may experience minimal discomfort from the liver biopsy when the special needle is inserted to get the sample of your liver tissue. The sample of your liver obtained from the biopsy is used to examine any liver damage under a microscope. In summary, it is important to consult your doctor to gain a complete diagnosis about whether or not you may have NASH, and to discuss the potential for enrolling in a clinical trial that is suitable for you and your condition.